Okay, this video is what is the most reliable form of birth control for women? And this is unofficial. This is not based on a review of the literature. This is simply based on a conversation. I have a lady friend who is a ultrasonographer, and she does tons and tons of gynae ultrasound, for pregnancy, rule out ectopic, all of that kind of stuff. And she's been doing it for decades, and she's a smart lady. And interesting thing came out of our conversation when we were discussing a patient that, in her experience, the oral contraceptive is by far the most effective form of contraception. She says it's very, very, very rare that she sees anybody get pregnant who's taken the pill. And if you read the statistics on it, people who take the pill correctly, they also correlate with tremendously effective contraception. Okay, tubal ligation obviously is a great reliable form of contraception, but it's very difficult to reverse. Withdrawal method has a high incidence of leading to parenthood. Condoms, a little more effective certainly, and they also have some protection from sexually transmitted diseases. Some of these spermicides and foams, I'm less impressed. You can look up the numbers and statistics for yourself on the computer. IUDs can have other problems. They can get misplaced. They can penetrate into the uterine muscle layer, the myometrium. What I thought was interesting, according to her, my lady friend, she said that arm injections in her experience don't work well. She said she's seen lots and lots of patients get pregnant that they had the arm injections of the birth control medications. One thing interesting about oral contraceptive pills, anything that increases estrogen levels, a woman's not going to menstruate, she's potentially not going to menstruate. There's different amounts of dose a person can take, but the less a woman menstruates, the higher her hematocrit's going to be. That means her red blood cell count in her blood. The thicker her blood's going to be. The other thing is women who smoke cigarettes also will have thicker blood. Because of the lack of oxygen delivery, tissue hypoxia, they'll have a higher hematocrit. They'll also have vasoconstriction from it, meaning narrowing of the arteries. The point being is if a woman both takes the oral contraceptive pill and smokes cigarettes, then they'll have a significantly increased rate of deep vein thrombosis, blood clots in their legs. Those could potentially be tossed up to the lung. So I thought that was interesting too. I've read that in the literature, and she also confirmed that for me. My ultrasound sonographer lady friend, she's got a lot of experience doing lower extremity DVT ultrasound, and she says that combination, in her experience, they're on the pill and they smoke cigarettes. Very bad. It's crazy for a woman to smoke. I mean, one of the most valuable things a woman has going for her when she's young, she's attractive, and you super rapidly accelerate aging. I mean, I've seen women, they're in their late 20s and they smoke cigarettes and they look like they're in their mid 50s. They look terrible. It rapidly causes aging. So anyways, I just thought that was a little bit interesting, hearing it from somebody with a lot of experience. And of course, go ahead, check the literature, find whatever you find.